I'm going to give you a report on Casey Bay. So, Casey is a 66-year-old female. She came in from a rehabilitation center, which she was planning on going home, and then went to the OR because she had a bowel perforation and free air in her abdomen. And she also presented with 4+ pitting edema as part of her main diagnosis. Her background, she's on seizure precautions. She had the bowel perforation and free air in her abdomen, so she has got a midline abdominal incision. She has 4+ pitting edema. She had surgery for this on March 3rd of 2019. She also, as part of her history, had food being diverted from her, so we're doing daily weights because she weighs 31.3 kilograms, and that includes all the edema. She's had a history of falls, a double knee replacement, and a history of seizure precaution, so we're doing NeuroChecks Q4 for her. NG tube was placed. She was not tolerating her feeding. She has been very nauseous all shift, and her goal is to run at 40 mLs per hour. We did give Zofran to help, and we had to stop and hold the feeding, according to Dr. Kim. She also has urinary retention from the Foley being pulled in anesthesia. She is not voided on her own currently, after the Foley was removed 36 hours ago. So she is a full code. Last vitals taken were heart rate of 66, BP of 141/97, temperature of 98.9, respirations of 18, O2 of 96% on room air. She has presented with a 4+ pitting edema, weeping old femoral central line site. We've had to change the bandage on that 3 or 4 times. We're doing pressure dressing, so trying to stop the weeping and to help heal that area. Bandage from injury on right arm was changed 3 times during our shift. It is just a weeping site, serous drainage, moderate amount, and if you don't change the dressing enough, it will leak onto her sheets and her chucks and her gowns. That needs to be changed. Neural checks remain at baseline. Heart and lungs sound good. Residuals at 5 ml. We did give her a heparin injection, and then she weeped from the heparin injection site, a very moderate amount. She's had no bowel movements, bladder scan of 455. We contacted Dr. Kim. He told us to straight cath. We got 200 mLs back. We bladder scanned again afterwards according to Dr. Kim's orders, and then it showed 415 left in her bladder. We bladder scanned her right at the end of our shift, and it showed a bladder scan of 522. She's presented with generalized weakness and has been on bed rest our whole shift. She has a PIV on her left upper arm, a PIV on her right arm. Dressings were changed today, and they're good for 7 days, and caps are good for 4 days, and those need to be changed in 3 days. Today she had a KUB for NG placement to see if that was causing any of the nausea or vomiting. Ultrasound of abdomen to look for any more blockage or bowel perforation. That came back good. The KUB for NG placement came back good. She has been reporting 10 out of 10 pain everywhere. Daughter reported that she does this because she's an addict and she's had several opioid overdoses in the past. Oxy, to treat her pain, we've been using Oxy 5 milligrams Q6 hours, and then scheduled Tylenol, which we have to crush and then put through her NG tube. Potential complications for her would be nutrition, her not getting enough nutrition for her body requirements, potential infection because of the midline infection site, and then she is weeping a ton, and so nothing is healing because everything is just staying too moist. Her volume status we're worried about because even though she's a edematous and has too much fluid, she's not really taking in enough at all. And then an aspiration risk, she's working with speech therapy to help with this. So my recommendation would be the doctor stated that she needs to be rebladder scanned at 2300 and call if she does not void on her own before this to get another order for a straight cath, and this would be Dr. Screama. Restarting feeding at 2100 and seeing how well she is tolerating the feeding. If she's still nauseous and wanting to vomit, we need to call Dr. Kim to get orders based upon this. There's no pending procedures. Her discharge is to be discharged to a subacute rehabilitation facility, and discharge date is to be determined. Needs blood drawn for a blood culture. However, no one from the phlebotomy can access a line. Going to try to get a blood draw from the foot the next round. They decided to put in new orders and go work on their other clients before they came back to her. And then another recommendation would be to see speech therapy will see her tomorrow to assess when she can start eating and trying to work on that. However, it's probably going to be delayed since she is experiencing nauseous and vomiting symptoms. Do you have any questions?